friends, Dr. Corey Babb here. I have a statistic that's going to blow your mind. Around 40% of women in the United States deal with some degree of sexual dysfunction. That means approximately 66, that's 66 million women in the United States will deal with some degree of low sex drive, problems with arousal, pain with intercourse, or orgasmic dysfunction at some point in their life. Are you surprised? Isn't that crazy? Do you want to know more? Well, come with me on today's episode of Intercourse Discourse, and let's get to the root of things. Now, some of you out there may be asking, what do I mean by sexual dysfunction? And really, we can break that into four main categories. Issues with desire, or the want or need to engage in sexual activity, arousal, the physical response to that want or need, sexual pain disorders, i.e., does it hurt with penetration? Does it hurt with touching in sexual ways? And then the fourth is orgasmic dysfunction, or do you have issues achieving orgasm? Is orgasm painful or anything like that? Those kind of make up what are called four domains of sexual dysfunction. And that's the same for both men and women too. Now, obviously, both genders are going to express those things differently, but that is the overall definition of sexual dysfunction itself. Sexual issues as a whole are poorly reported in the medical literature, and whether that's due to a issue with a patient not really wanting to talk about it or not bringing it up to their provider's attention, or from the flip side, the provider not feeling comfortable talking about those issues to their patients, it's kind of anyone's guess, whether it's a chicken or the egg. I know from personal experience, being taught in medical school to address a sexual health questionnaire, which basically amounted to two questions. Are you sexually active? Yes or no? And then, do you have sex with men, women, or both? Well, as you can imagine, that's not really all that effective when you're talking about someone that comes in for a sexual question or a sexual problem. After that, one of the other main issues is that the majority of physicians are not well trained in sexual medicine. Even being an OBGYN, my own training in residency was not that great when it came to sexual health problems. I had to do additional training afterwards to get to the point where I am today. So we've kind of created this precedence where patients don't feel comfortable talking about sexual issues, providers don't feel comfortable talking about sexual issues, and even if one of the two starts that conversation, it's really there's a lack of knowledge when it comes to what we can do to help the situation. I want you to think about something. Now, driving down the road where I'm from, I'll occasionally see billboards for clinics for male sexuality, or getyourerectionback.com, or different things kind of along those lines that deal with male sexual functioning. It's very prevalent in our society, and it's very well accepted. You look at commercials on TV, and advertisements for pills that help with erectile dysfunction are everywhere. And it's, like I said, nothing to be ashamed about anymore. Now, flip that around. When's the last time you actually saw an ad for medication to help with women's sexual issues? Well, probably not very recently. Currently there is one medication on the market that's FDA approved for low sex drive in women. Just one. Think about that in comparison to the number of medications for heart disease, or the number of medications for erectile dysfunction. Kind of looking at this statistically, it's insane that we have such a large number of women in the United States that are dealing with sexual issues, and yet the attention to it is almost negligible. There are 30 million Americans right now that suffer from diabetes. 15.5 million Americans are cancer survivors. The number one killer of Americans, kind of across most age groups, is heart disease. So roughly 610,000 Americans die every year from heart disease. These numbers pale in comparison to the number of women that deal with sexual problems. And yet, where is the research? Where's the medication? Where's the answers to these questions about why is this affecting me, or why am I like this? There really is such a discrepancy that it's frustrating from a healthcare provider to see patients come into my office and have been to multiple providers and not had any answers to their questions. So here's the heart of the matter. If you feel like you are one of those 66 million women that suffer from some degree of sexual dysfunction, whether that's low sex drive, whether that's difficulty getting aroused with sexual activity, pain with intercourse, or problems with orgasm, you are not alone. And there is hope. There are treatments that we have that we can offer to help you restore your sex life to what you want it to be. That's the point of this intercourse discourse. That's the whole reason in starting this sub-channel, and I hope that you will join me in the future. Thanks again for watching. I'm Dr. Corey Babb. If you like what you've seen today, please like my channel and hit that bell to subscribe for future notifications when I post new videos. Otherwise, have a happy, wonderful week, and I'll see you soon.